Well, the bill which amends the Children's Act, in fact, incorporates language that used to exist in the Minors Act, which was repealed in 2010 when the GSD brought in the Children Act. And all it does is that it places it on a statutory footing that a doctor should feel entirely comforted by law that a 16 and a 17-year-old can give permission for dental, surgical, and medical treatment. In the absence of that provision, the Gibraltar courts would, I imagine, have relied on the case of Gillick, where essentially, in that particular case, it was decided that a child of 16 or 17, depending on the child and depending whether they have all the relevant information and the capacity to make a decision, should be able to do so, but always trying to obtain parental permission first. But what the amending bill does is that it gives consultants and doctors the comfort that should they in a clinic decide to, for example, provide a prescription for a contraceptive pill, that the 16-year-old girl does in fact have the right to consent to that treatment being given.
Now this, in effect, empowers 16-year-olds to decide that they want to have cosmetic surgery. Is this something that the government is comfortable with?
Well, remember that the GHA does not pay for cosmetic surgery unless the cosmetic surgery is clinically indicated. In other words, there is a cosmetic element to the procedure being conducted, like for instance, straightening your nose, a septoplasty, which would have an aesthetic impact, but the reason for the operation is because the person can't breathe properly.
Fine, but what I'm suggesting is that this new law gives 16-year-olds the power to choose to have cosmetic surgery regardless of whether the GHA pays for it or not.
The answer would be yes.